Sierra Leone is borrowing from lessons learned during the Ebola outbreak to raise awareness on the transmission of coronavirus. The government spokesman on COVID-19, Solomon Jamiru, tells VOA the country has suffered huge economic losses as a result of the pandemic, but it is repurposing every available resource to protect its citizens. I spoke to Mr. Jamiru, who begins with an update on the number of infections, recoveries, and deaths as of late Wednesday.
For cumulative confirmed positive cases, we have 909. We have 47 total number of deaths. The active cases, that is cases in the last 24 hours, based on 153 samples analyzed, is 13. The active cases that are at our isolation centers is 371. And the cumulative recoveries stand at 491.
So are you seeing any spike in the number of infections? And if so, which part of the country?
We have been, unless for the last 72 hours, we have been very much concerned about the western area, which in substantial part had been considered as the hotspot, the epicenter of the disease. For today, for example, we only had 3 in the western area, and yesterday there was none, and 48 hours ago we had 4 in the western area. So in terms of spike, I would say that there has been some fluctuations in the figures, and that is largely due to where you conduct the tests as well.
So how are you responding to those spikes in those areas? What needs to be done?
Because there is evidence of community transmission, there is an emerging thinking that it may not be so helpful if you pay so much attention on identifying and tracing individual cases. With evidence of community transmission, it means it is about time you expanded the scope of your test and start going into communities so you have an idea of how spread this community transmission is.
We've also had reports indicating a lack of equipment for health workers as well as hospitals. How is the government taking care of that concern?
So in terms of the necessary equipment, I would say we would continue to secure what we have to secure within the limited fiscal space from government, and also relying on some of the things that are trickling in from international partners. We continue to prioritize our healthcare workers, our healthcare professionals.
In the past couple of years, Sierra Leone had to deal with the outbreak of Ebola. Any lessons at all learned from that experience that can be useful now during this pandemic?
So yes, we have been able to learn from Ebola, even with respect to risk communication and social mobilization, where I am pretty much involved. We have been able to work closely with the existing structures, those structures that were utilized to address Ebola. We are essentially utilizing those structures. We are going into communities. We are talking with the relevant stakeholders, market women, the youth groups, the religious leaders, the traditional leaders. And this exactly was the structure that was utilized in terms of risk communication and social mobilization.
I imagine Sierra Leone has people who speak different languages or dialects, if you like. How are you able to reach those people that can't speak English and may have a bit of difficulties understanding what is being given out there by the media or the government representatives, so they can understand it in their own language, how to protect themselves from infection from this pandemic?
We have what we call the Sierra Leone Association of Journalists and the Independent Radio Network. It's an established partnership. So we ride on that platform where, for example, we could utilize, they have a scope of about 65 or more radio stations. So for important life-saving messages, we make sure that they are translated into those local dialects. And also when we have our community mobilizers going into the different parts of the country, we make sure that we identify the public influencers in those communities who could speak to their people, who could be listened to.
How are you using the media to get the message across?
We make sure that every day at 11 a.m. we have a press update, and this is covered. We've got an extensive media coverage for this, and we also have some of them who are helping us on social media platforms We have appointed risk communication officers in the districts, in the 16 districts of Sierra Leone, social mobilization leaders, district spokespersons, and we have ensured that we have media coverage for important facets of the emergency response.
Are you planning to lift the lockdown restrictions soon? I know they were put in place early May. Do you have any plans to lift those restrictions soon?
So once we get to the point where we are sure that if that action is taken, it will not injure us, it will not jeopardize the fight against coronavirus, absolutely, it will always receive the favorable consideration of government.
That was Solomon Jamiru, Sierra Leone government spokesman, discussing his country's efforts on COVID-19.